Hello, everyone, and welcome to ADO's July webinar. And in anticipation of World Hepatitis Day next week, we'll be taking an in-depth look at the symptoms, causes, and treatments for the disease. Today's speaker is Clinical Assistant Professor from Georgetown University and ADO's Medical Director, Dr. Howard Zahalsky. Welcome, Dr. Zahalsky, and thank you for joining us today.
Thank you again, Tom. So today we're going to be talking about hepatitis. So the first question you have is, what is hepatitis? And hepatitis is anything that causes inflammation of the liver. So your liver is that dark, ruddy brown organ that you see in the picture. It's in the top left corner of the picture, but it's actually in the upper right side of the human body, kind of right underneath your lower right ribs. The liver has lots of things that it does in your body. Its main job is to help you digest certain foods, and the other thing that it does is eliminate toxins from your body. So when we're talking about the liver, we really need to focus on that without the liver, lots of poisons can build up in your blood and cause a lot of problems for you. Now, another thing that we need to know about the liver is that the liver is very resilient. The liver bounces back from darn near everything. In fact, you can donate, if you have a family member with some liver problem, you can donate half of your liver to somebody else, and it will completely regrow. So the liver can really take a lot of beating without doing permanent damage to it. So if you do have hepatitis, if your liver is getting inflamed, either you have a bad infection or you've done something really, really awful to it. So now, what is this really awful hepatitis, and what are the consequences of getting hepatitis on your body? And we'll see that in our next slide. So this is a normal liver on the left, and on the right you see a cirrhotic liver, a liver with cirrhosis. If you have hepatitis and inflammation of your liver, and you don't do anything about it, and it lasts long enough, it can lead to cirrhosis, in which case your liver, to be honest, looks like an overcooked hamburger. It just gets old looking and crusty and scarred. The main problems with cirrhosis are, number one, the liver doesn't work. It obviously becomes harder to digest your food, and it doesn't clean out the blood. When it doesn't clean out the blood, these toxins that you eat naturally, we naturally eat toxins in the blood. In fact, anything that has protein in it is to some degree toxic to people. If those proteins build up to a high level in your blood, it gets converted to ammonia. Yes, the same ammonia that you clean things with and use to kill bacteria. When that gets to your brain, it can lead to what we call hepatic encephalopathy, where you stop thinking right. All of that's caused by the lack of the liver to do its job and can be very difficult to treat. The other complications of late-stage hepatitis that leads to cirrhosis is that blood doesn't flow properly through the liver. You'll notice in these pictures of the liver, there are several what are actually blood vessels going around and through the liver. All of the blood from your lower body, before it gets back to your heart to get pumped around, has to pass through the liver for detoxification. If your liver is all scarred up, the blood can't freely pass through the liver, and it becomes a traffic jam. The blood from the lower half of your body has to sit there and wait its turn, and we'll get to what the complications are from that in a few minutes. But what the takeaway from this slide should be is, when you have a normal liver, if you do too much damage from hepatitis, you can end up with liver cirrhosis, which will cause problems with toxins and problems with blood flow. Now, let's say you're in the earlier stages of hepatitis. What are some of the first things you can see, first signs that you might be having a problem with your liver? So here is one of the most classic findings associated with hepatitis: jaundice. You can see that the whites of this person's eyes are bright yellow. When you get jaundice, the first thing that will change color is the whites of the eyes. As your liver stops working, the yellow color will build up more, and your skin will go from a nice peachy pink color if you're Caucasian into a more orangey yellow color of more diffuse jaundice. The good news is that this should be taken as a warning shot. Remember, I said the liver is resilient. And if you catch it at this stage, you can often reverse the process because, again, the liver is so resilient. The jaundice itself is not dangerous. Once you are more than a week old, jaundice cannot hurt you. The yellow color is temporary and will ultimately go away, and is caused by bilirubin, one of those digestive chemicals that the liver is supposed to eliminate from your body, building up. But the high levels of bilirubin themselves do actually nothing to hurt you. This is merely a symptom and a sign that you need to pay more attention to your liver. Now, let's say things get worse. You don't pay proper attention to the jaundice associated with your hepatitis, and you allow things to progress. Here is somebody you would say, if you just looked at that picture, you would say, well, you're showing me a picture of a pregnant person. You must be putting this slide in there to say pregnant people should pay attention to their liver. No, this is not a pregnant person. This is someone with ascites. What is ascites? Ascites is when all of that blood that's supposed to be going back from your lower body, from your intestines and your legs, through the liver on the way back to the heart to get pumped around again, gets backed up and can't get through the liver. Where does it like to pool? The belly. So this is a belly that is full of fluid, blood and liquid that is in the bloodstream. It all just deposits there in the belly, and the belly will get stretched out, and sometimes you even have to stick a needle in to drain it because you can get so much fluid it can push up on your diaphragm and get in the way of your breathing and even lead to infections because all of this fluid is just sitting there. You usually get ascites once your liver has gone from the early stages of hepatitis through the middle stages of hepatitis, and you've gotten into that scarred down liver of cirrhosis. So usually this is someone who had hepatitis who we were unable to, or the patient was unwilling to get the treatment that they needed to prevent it from causing end-stage liver damage. All right, so now we've gone through what the results of hepatitis are and the complications of hepatitis and eventual cirrhosis. But what you really want to know is, how do I keep this from happening? What are the causes of hepatitis? And we'll see the first cause of hepatitis on the next slide. Everybody knows that alcohol is not good for your liver. Alcoholic hepatitis is probably the most common form of hepatitis. It's caused strictly by too much drinking. And what is too much for one person isn't always the same as too much for everybody else. And just because you've built up a high resistance from years of drinking and you don't feel like you're getting drunk with 3 or 4 beers at a time anymore, doesn't mean your liver agrees with you. Chronic, regular ingestion of alcohol will cause the liver, throughout the entire liver, to become irritated, and that's hepatitis. But again, the alcohol is very resilient. And if at any point, maybe when you get jaundiced, maybe when your doctor checks your liver tests and tells you that they're abnormal from your drinking, you stop, most of the time, that all of that damage can be reversed just by stopping drinking. Now, if you don't stop, if you've seen the warning signs, if you've gotten jaundiced and you keep drinking, it can eventually get so bad that you end up with that cirrhotic liver, at which point the damage can be permanent. But alcohol is going to be the leading cause of hepatitis. But most of the time when medical doctors are talking, oh, you have hepatitis, we're talking about a different type of hepatitis. Most of the time we're talking about viral hepatitis, hepatitis caused by a virus. And there are 3 different types of viral hepatitis, and we've conveniently labeled them hepatitis A, hepatitis B, and hepatitis C, just to make them easy to remember. So here you have hepatitis A prevalence. As you can see, it's pretty much prevalent everywhere except for the North America, rather north of the Rio Grande, the areas of Western Europe, and Australia. That's because hepatitis A is a disease of sanitation. Hepatitis A is a virus that is spread through fecal contamination, basically pooping into water. And people poop into the water, and then other people drink the water, and then they get the hepatitis. It is a very common disease in many parts of the world that don't have the best sanitation. People wash their clothes or dump their sewage into the same rivers that maybe become ultimately their water supply. So certain places you go on vacation, you may want to be drinking bottled water rather than bathing in the local swimming pool or drinking the local tap water. The good thing about hepatitis A is that it causes no permanent damage. It is a disease where your liver gets very, very inflamed very, very quickly, and you will get jaundiced and you will have extreme belly pain often for about a week to 2 weeks, and then it always goes away 100% of the time. So the challenge for doctors is just to make sure that you stay hydrated and are able to eat enough during that 2-week period that you're going to have belly pain and nausea and vomiting. But the disease itself will ultimately calm down, all of the liver irritation will go away, and it's a disease that you can only get once in your life, and then you build up antibodies to it. So hepatitis A, although certainly the most common of the viral hepatitis diseases, is also the least serious to get, although it feels horrible at the time. So here you have a picture of someone giving an injection into a vein. That's because hepatitis B is traditionally most commonly spread by IV drug abuse with dirty needles. It can also be sexually transmitted. Hepatitis B is a disease that is most frequently picked up on routine blood work. You go to see your doctor, maybe you're feeling okay, maybe you're not feeling okay, and your liver tests are just a little bit abnormal, and your doctor does some tests and finds that you have hepatitis B. Hepatitis B is a smoldering disease. Unlike hepatitis A, where you get a tremendous 5-alarm blaze fire in your liver that hurts and you get nausea and vomiting and only lasts for 2 weeks, hepatitis B comes on very slowly and gradually. You usually don't have any nausea or vomiting. You usually don't have any abdominal pain, but it slowly burns through your liver like a brush fire. And if you do nothing about it, up to 25% of people with hepatitis B can ultimately get cirrhosis, or the permanent damage to their liver. But there are treatments available for it. The problem is the treatments are oftentimes worse than the disease itself. Again, only 25% of people progress to the outright cirrhosis or permanent damage, while the treatments, which have names like interferon, make you feel really, really sick and only work less than 50% of the time. So a lot of people are reluctant to do the treatments, and they just keep their fingers crossed and hope that the disease never progresses to cirrhosis, which takes 20 or more years in most people with hepatitis B. Now let's move on to hepatitis C. Hepatitis C traditionally was spread through transfusions. Nowadays, it is spread a little bit more by IV drug abuse as well, and slightly through sexually transmitted mechanisms, but it is less sexually transmissible than hepatitis B. Fortunately now, we are screening blood supplies much more carefully for hepatitis B, but it was the third one to be discovered, and some hepatitis C got transmitted through the 1970s and 1980s before we were able to figure out exactly what it was. It is a somewhat more aggressive disease than hepatitis B. Up to 50% of people with hepatitis C, as opposed to 25% with hepatitis B, will progress towards cirrhosis. Again, interferon can be used for hepatitis C, but it is less useful for hepatitis C. Hepatitis C doesn't seem to respond to it quite as well, making this a more difficult disease to treat. So what are we going to do to prevent the hepatitis diseases? Well, fortunately for hepatitis A and hepatitis B, we have developed diseases. Hepatitis A and hepatitis B vaccines are given to pretty much all children born in the United States. By the time they reach 5 or 6 years old, they've probably completed their series of both hepatitis A and hepatitis B. We've been doing this for 20 or 25 years now, so all young people should be protected against hepatitis A and hepatitis B. Now, the younger people are probably more likely to be the drug abusers, so we're probably getting past the biggest time of concern of people getting hepatitis B from IV drug use, since most children in the United States are vaccinated. But older people still like to go traveling. So if you're over 25 years old and you plan to go to one of those red areas on the map I showed a couple slides ago, then you might want to think about going to the doctor or a travel clinic and getting a vaccine for hepatitis A to protect you against that. Again, that's usually not a life-threatening disease, but 1 or 2 weeks of vomiting and abdominal pain is sure going to ruin your trip. Unfortunately, we do not have a vaccine yet for hepatitis C. So we don't have anything we can do yet to entirely protect against that, although, again, most of the people who have and have gotten hepatitis C are now in their 40s and 50s and 60s and got hepatitis C from blood transfusions within the last 20 to 25 years. The good news is we now have a cure for hepatitis C. We don't have any cure once you get hepatitis A or B. And again, the interferon only works so well. But we do have a cure that works in 95% of people with hepatitis C. The cure for hepatitis C is a pill. It's a very simple pill. It's a pill that has almost no side effects. It's a pill that you take one pill once a day for 12 weeks. There are now 3 such pills, and the one you probably have heard the most about is called Harvoni, but there's 2 others that work pretty much exactly the same way. Very easy to give, very well tolerated, complete cure for hepatitis C in 95% of the cases. So what's the downside? The cost. Drug companies have currently priced the hepatitis C medicines as the most expensive pills on the market. Each pill currently costs approximately $1,100. So multiply that by 3 months, and you get close to $100,000 for a 3-month supply of this medicine. Needless to say, insurance companies have been a little bit reluctant to pay for this. They've, in fact, been rejecting sometimes claims for the medicine on the basis that, well, if we have a patient whose liver tests on the blood tests are stable and it does not look like they're progressing to cirrhosis, why would we give them the medication? And if you're a patient with hepatitis C, you say, well, I don't want to risk spreading it through sexual transmission to my partners, and I don't want to always be worrying that maybe it's going to progress to cirrhosis. I want the medicine, and I'm paying for my insurance, so I deserve to get the medicine. The other problem is that in other countries, they have priced the medicine much differently, but the U.S., with its patent regulations, the drug companies are able to keep the price up there at $100,000 for a course. I recently read that in India, you can get the entire course of treatment for about $1,000. So some people are taking a vacation to India, getting the medication and coming back and saving $89,000 minus the cost of airfare if their insurance company is unwilling to pay for the medication. Now that there are 3 medicines for this hepatitis C, 3 different medical cures for hepatitis C, it's anticipated that the price will come down. And as the drugs lose their patent, which will take approximately 5 or 6 more years, the prices should decrease significantly. But for right now, the biggest obstacle to curing people of hepatitis C is the cost. So how can Activ Doctors Online work with you to keep you safe from hepatitis and to treat hepatitis? Well, we have 3 solutions. First is our personal health records. Our personal health records can be invaluable here. They allow you to keep track of all of the vaccinations that you've had, whether they be through childhood or adulthood. Maybe those vaccines records otherwise get lost as your doctors retire, or you move from a pediatrician to a grown-up doctor to your 3rd grown-up doctor as you move, and no one remembers what you were vaccinated against. With our personal health records, you're in control of your records. We help you acquire all of that information and maintain your records so that wherever you go, whatever doctor you go to, whatever country you go to, all of your vaccine records are with you. Also, all of your liver tests are with you. Most people 40 and over are getting yearly blood work with their yearly physicals, including liver tests in most instances. We can follow your liver tests with you, and our intelligent PHR will alert you if there's been an adverse trend, a bad trend in any of your blood tests, so that we can help you figure out when you should be asking your doctor, hey, is this a problem? Should I be tested for hepatitis? Is this something I need to worry about? Next, we have our second medical opinions. Should you have hepatitis of any type? Should you want to be put in touch with one of our top hepatologists, liver specialists from around the country or around the world? That's exactly what we're here to do. By using your electronic medical records, we can send your records to some of the top doctors in the country and in the world to let you know what we think about your current treatment plan. Are you a candidate for some of these novel treatments? Should you be getting interferon if you have hepatitis B? Are you a candidate for the new expensive medicine if you have hepatitis C? And finally, with our e-consultation feature, we're able to put you in touch with your doctor virtually and maybe save you having to take a trip to the doctor for routine liver follow-up and make life easier for both you and your doctor. Now with that, I'm going to turn it back over to Tom, who will tell you a little bit more about Activ Doctors Online and our philosophy of healthcare.
Well, thank you, Dr. Zahalsky, for another excellent presentation. Here at Activ Doctors Online, our vision is to reinvent healthcare by providing user-friendly, mobile health solutions that allow people all over the world to live safer, healthier, and more productive lives. We strive to educate, engage, and empower our members to take control of their health destiny to save time, money, and even lives. We hope you enjoyed today's presentation, and we invite you to get started with a free 30-day trial over at activdoctorsonline.com and by clicking Get Started. For more information, to schedule a demo, or if you have any questions about our service, please feel free to contact Activ Doctors Online using the information on screen. We're also available via all the major social media channels. Thank you for watching, and we look forward to seeing you next month for another informative health webinar.